Okay.
Okay, so good day, everyone. My name is Dr. Amarachi Bayo. I know you guys already know me. I'm a pediatric neurologist and a lactation consultant. So thank you for coming. Thank you for taking out from your time to be here. I don't take it for granted. And we'll be talking about optimal breastfeeding. This is just like an overview of what we'll do in the following weeks. Today, we'll just focus on the introduction. So we'll be talking about introduction, definition of terms, why optimal breastfeeding, so introduction and definition of terms, we'll be doing that today. Week 2, we'll be doing why optimal breastfeeding is important. Week 3, common myths around breastfeeding. We are going to be debunking the myths with evidence. Week 4, we'll be talking about obstacles of breastfeeding. That's the common barriers to optimal breastfeeding. Week 5, we'll be talking about the composition of breast milk. What makes up breast milk is very important. Please can you go to the next slide? Week 6, we'll be talking about the physiology of breastfeeding, how breast milk is formed, what controls it. Week 7, we'll be talking about the practices that support breastfeeding, proven strategies that ensure the successful execution of optimal breastfeeding. Then week 8, we'll be talking about breastfeeding options. Week 9, problems encountered during breastfeeding. Week 10, how breast milk is expressed and the methods of expressing breast milk. It's not like we're going to stop at week 10, but I just did this as a framework to guide us on what to expect. There are so many other things we'll discuss, but as time goes on, we'll continue like that. Next slide, please. So these are the learning objectives for today's presentation. So why is breastfeeding important? So this is an introduction. Why is it important? Definition of what optimal breastfeeding is. Then the breastfeeding statistics and the energy composition of breast milk. Please next slide. So before I start, I would want to tell you personally why I'm so passionate about breastfeeding. A lot of people will say and ask, Dr. Bayo, what is the reason? Why are you this passionate? Why are you, why are you carrying it in your head about this? What is the reason behind your passion for breastfeeding? So I'll just tell you a small story. The story is long, but I'll just give you an abridged version today. We'll continue another time. So, like my name is Dr. Amarachi Bayo. I'm the first child in a monogamous family with 4 children, and just as a backstory, my mom had me, 3 years after she got married. So she was looking for a child for 3 years, and then she had me. So after having me, thanking God that God has opened her womb, she had my younger sister. She got pregnant for my younger sister 2 months into 2 months into my delivery, and like that she gave birth to us back to back to back. There was no spacing. I senior my junior sister with 11 months. My junior sister senior my brother with 1 year. It was only the last child that there was maybe 3 years gap between us and her. So that really affected. So I was only breastfed for 2 months, and after that I was breastfeeding, and breastfeeding was stopped because my mother was pregnant. And there's this myth that once you are pregnant, you should not breastfeed your child. So breastfeeding was stopped for me. And so all the problems, sincerely, I felt that all the problems I had in my life started with that singular decision, because I felt alone, I felt abandoned, there was no attachment. You can imagine living in a house where you feel like a stranger. I felt that way. And it's spiraled to a lot of things, which I may not be able to talk about now. When I'm ready to talk about it, I'll talk about it. But looking at my life, as in introspecting into my life, I feel that everything that happened to me started from that singular decision of not breastfeeding me optimally. And so it gave me, when I got into medical school and decided talking about breastfeeding a bit, I made up my mind in medical school that I was going to exclusively breastfeed my children no matter what happened and no matter what it is. And I have two children now by the grace of God, and I've done that. My first child, I did exclusive breastfeeding, and I think I breastfed her for like 1 year, 8 months. But this is my second child. I'm saying that as God gives me strength, maybe by 3 years, if you still see me putting breast in her mouth, please don't be angry, don't be angry with me, because of the knowledge that I have. So that's what makes me very, very passionate about breastfeeding. Can you go to the next slide, please? So introduction, why is breastfeeding important? What is the big deal about breastfeeding? Why are we just wasting our time? Why will I not just sleep? Why are we just wasting our time? So number one, nutrition in the first 2 years of life is very important, because this is the time when the brain is growing, is rapidly increasing in size. This is when the brain is, forming. Yes, the brain forms inside the womb, but it doesn't develop completely. It still keeps forming and growing, and the first 1,000 days, we call it the critical 1,000 days. That's the first 2 years of life. It is very important, and nutrition in this time, affects brain growth and development. Malnutrition is the leading cause of death in children. WHO has found out that about 149 million children are stunted. Stunted means that they are short for their age. About 46 million are wasted. That's their malnourished. And about 37 million of these children are overweight. So malnutrition is not just underweight. Overweight is also malnutrition. And these are the statistics. WHO now recommends that breastfeeding is one of the major child survival strategy that prevents infant and childhood mortality. So it's one of the basic child survival strategy. It's something that if we can implement on a large scale, we will stop having high infant mortality and morbidity. You understand? Breastfeeding is the safest way to ensure that adequate nutrients in the first 2 years of life is achieved, leading to optimal growth and development. So you see why they recommended that you must give your child breast milk or up to 2 years. Number 5 is that breast milk is nutritious, is the safest food you can give your child, and is described as a living tissue or miracle fluid. Indeed, it's a miracle fluid. A lot of people don't understand. I tell people that anything you see that the devil is fighting, understand that it has a very important role in defeating him. The devil doesn't want people to breastfeed their children. That's why there's breast augmentation. He'll come and tell you if you breastfeed, your breast will be flat. And this thing. What has made it, is I don't know why it's only human beings that don't have sense. I'm sorry to be that blunt, but why it is only human beings that are finding difficult to understand things. A dog doesn't think I cannot breastfeed my child. A goat doesn't think I cannot breastfeed my child. An ape doesn't think I cannot. It's only a human being that will say I cannot breastfeed my child. So it just shows you how, even though we are more complex in our thinking and reasoning, we are beginning to be more, but I don't blame everybody. I don't blame them. I don't blame anyone. It's just the hype, social media hype, what people are saying. But thank God, God has sent me to destroy all those hype and to teach people how to do the right thing. Next slide. So what is the definition of optimal breastfeeding? Optimal breastfeeding is divided into 3 important categories. It cannot be optimal breastfeeding if you do not do these 3 things. Yes, you can do one, but it will not fit as optimal breastfeeding. So what is optimal breastfeeding, which is what we are advocating? Number 1, early initiation of breastfeeding. This means that breastfeeding is initiated in the first 1 hour of life, not after 2 hours, not after 24 hours, in the first 1 hour of life, early initiation of breastfeeding. The second one is exclusive breastfeeding for 6 months. Let us take into action. Let us understand 6 months, not 3 months, not 4 months, 6 months. And this includes that's only breast milk, no water, no agbo, no grip water, no, I don't know anything apart from maybe multivit and drugs that are prescribed in the hospital. But any other thing that you add, no glucose water, exclusive breastfeeding for 6 months. Then the third component is continued breastfeeding to 2 years and beyond. So if you can do up to 4 years, very good. If you can do 3 years, very good. And this is after addition of safe complementary feed. So it is known that after 6 months, breast milk is not enough to meet the energy requirement of the child. So after 6 months, you need to add safe complementary feeds. We'll still talk about this, later. So you need to add safe complementary feeds, but continue breastfeeding. Breastfeeding should still be the major source of energy requirement in the child. Next slide, please. So let us talk about the statistics, breastfeeding statistics. Early initiation of breastfeeding has found that only 46% of children are put to breast within the first hour. Only 46%. Can you imagine? And that only 48% were exclusively breastfed in 2000 and were exclusively breastfed in 2025 in 2025, only 48%, and the goal for 2030 is 60%. So only 48%, even though there was a rise, initially it was 37%, but now it has risen to 48%. But the goal for 2030 is 60%. In the research they did, continued breastfeeding, only 71% continue to breastfeed for up to 1 year, and the goal was 80% for 2030. So in the last my goal is that 80% of the people that will undergo this training will continue breastfeeding for 2 years and beyond. That is my goal. So the essence, if people are educated, if people are counseled, if people are supported, then they can, make informed consent or maybe make informed decision about breastfeeding. I tell people it's a goal. You need to make a goal, a breastfeeding goal. Not everyone will be able to do up to 3 years, but some can decide to do up to 1 year and something. Just sit down, make a goal and say, this is what I want to do. Based on the information I have gathered so far, this is what I've chosen to do. But the truth is that by the time you've gone through this training and lecture, you will be convinced to even do for your child up to 3 years if it's possible for you. You understand? My slide has gone out. For Lake Alpha. Can you still hear me?
I can hear you. I'm here. I'm
Okay.
wondering maybe I mistakenly pressed and touched something. So can you see? Can you see? Okay, it's back.
I can see
Okay.
it.
Yes.
So it's all about making a goal. Everything in life depends on the goal you make for yourself. You understand? You set the goalpost and you walk towards it. So personally, my goal for every mother is to do the continued breastfeeding for at least 2 years. And because I'm the number one champion. If people are doing 2 years, I must do 3 years because I'm a leader. The leader always goes above and beyond. So please, that is what my goal is. Next slide, please. We're almost done. So the energy constitution of breast milk. The energy constitution of breast milk. Breast milk, delivers energy at different rates throughout. So in the first 6 months, 100% of it delivers 100% of the energy requirement. That is why in the first 6 months, there's no need to give water, there's no need to give any other thing. Breast milk is enough. It's enough to take care of a child. After 6 months, it delivers half of the total energy requirement. So yes, you need to add other things. Breast milk is not enough, but at least it gives half. So that's why if a child is sick and you say, oh, the child is only taking breast milk, it's better than a child that is not taking anything at all. Let me give an example. My daughter was sick like 2 or 3 days ago. She had malaria. So I was treating her for malaria. Can you imagine that she refused to suck, but she was eating other food? So because I knew, because of the knowledge I had, I said, okay, since you're not sucking, I will express the breast milk, use it to make her cereal, and she will eat it. While I kept gently trying to introduce her to the breast. So when she got herself, she started sucking again. You understand? Yes. So for people that say, my child is only sucking, he doesn't eat anything. You can imagine if he was not sucking. That means he would have just been malnourished. And these people, by the time we plot their growth chart, the child is actually even above the normal age for normal weight for age. You understand? They are too worried. They are too anxious. That anxiety is something that these lectures will actually help to debunk, because if you have knowledge and wisdom, you will not do things based on fear. You will not be anxious. You will do the right thing and you will be satisfied that you did, right? Then after 1 year, it produces or it accounts for 1/3 of the energy requirements. So after 1 year, it's just 1/3. So you see why it is important to continue breastfeeding your child. People that start after 6 months that start complementary feeding like pap and this, they want the child to finish a whole bowl of pap. That's not it. Breast milk is still the major food that you should give your child. Any other thing, if the child should take 2 spoons or 3 spoons, is okay. Feeding should be responsive. You try, you don't force. All someone that will do force feeding, hold the child's nose, hold the child. That child will hate eating. Feeding should be actually a fun time. People don't want to make a mess. Parenting is in a mess. You understand? I wish I put the picture of my child. Maybe I'll share it on my phone. I'll share a picture. She was eating spaghetti. That spaghetti, she only ate like 2 or 3 strands. Everything was poured on the floor. But that is it. They will pour it on the floor, they will pick it, they will eat it, and nothing will happen to them. They will not have any problem, because that is how they are supposed to be. But people want, let them finish 120 million. And that's the problem when you are using feeding bottle, when you're using bottle feeding, instead of feeding your child directly from the breast. People say, let it, he's no longer eating. Before he used to finish 150 meals. Now he's barely taking 80. What's your concern? Let the child determine, so far the child's growth is not faltering. Let the child eat the way he's supposed to eat. You understand? Let's no need to force feed him. If you if that's why I say make small volumes so that you don't be disappointed. You make small volume. If and follow the child, as he or she wants. If the child is hungry, the child will cry, and you know that, oh, this is hunger, and you give. And I also want to say that not every hunger, not every cry means that the child is hungry, but we'll get to that. Not every cry means that the child is hungry. Some cry means that I'm tired. Some cry means that I'm overstimulated. Some cry means that, oh, I'm wet. My diaper is soggy. I poo. Oh, I feel bad. Not every cry. And that's why people, all of a sudden become, he's always crying. Even after breastfeeding, he's crying. Some people, their children's temperament is cry, cry. For example, my mother said I cried throughout. I was always crying. Why won't I cry when I was deprived of the most important thing that would have helped me? Can you imagine if I was breastfed for 2 years and beyond? I would have been a genius. I would have been one of the 1% of the 1%. You understand? If I'm this brilliant and smart without exclusive breastfeeding, can you imagine if I was breastfed? So temperaments can make a child cry. A child with a very it's not every cry that means that the child is hungry. We'll talk about that later. So I think this is the end of my slide. Thank you for listening. Thank you for showing up. We have like 12, we are 13. I don't know, how do we snap Folake? I think you're my media agent now. How do we snap to show that?
Okay. So we can do that. I'll stop sharing. And do you want us to put on our camera or just
Yes, we can put on our camera. I want to snap first, then I will take questions, right? So let us snap first, then we'll take questions.
okay.
Stop
Oh,
sharing. Everybody should put on their camera. Don't worry, we are not perfect. just so that we can see ourselves. Thank you for showing up. Okay. So, like, how do we snap the picture now?
Okay, so I think it's just screenshots we are going to take.
Okay, how
If
do we
that
do this?
let me let me see what I've taken. I just took one now. I'm coming. I could share it, you see it, and oh, did that even work? Okay, let me try again, then I'll share with you, and then you can tell me if it's okay.
Well, anyway, it's okay. It's fine. Just something to that today is we are just trying our hands. Thank God. I'm so sorry. Thank God that it went well. By the grace of God, next week it will be better. So, are you done?
Let me be let me I want to check what I did so I can be sure that before people will drop off the call and I don't have anything. But I think you can go ahead with the questions.
So, uh, let's shoot. Any questions for me? So the webinars will be short, 30 minutes. In short, my plan was that by 7:30 we would have finished because I know that personally, me, I have short attention span. I don't want anything long so that it will not be burdensome, right? So that's why it's broken down in that way. So it's 30 minutes of your time to learn about breastfeeding. I don't think that would be too much. So any question? Okay,
I
Damilola,
have a question. Yes, so I have a
Damilola,
friend who gave birth this month, but due to the CS that was carried on, I think there was a bit of complication. So after an hour, she couldn't breastfeed. Then I heard that she said they said that she cannot breastfeed again throughout at all because she has missed not breastfeeding for about 2 hours. I was wondering that I've never heard something like that, so I thought to ask that is it so?
okay, so the truth is that it's a pity. A lot of people don't have knowledge about breastfeeding because, and I don't blame them. In our curriculum in medicine, we have a lot of things to learn. So subjects are prioritized, right? So we put more priority on maybe infectious diseases, epilepsy, and all these type of things. Let me give an example. In my second year or in my third year in the university, in our study of anatomy, we did all the anatomy until we got to neuroanatomy. When it was time for neuroanatomy, our dean said we must write exam, even though we have not read neuroanatomy. So we were not taught neuroanatomy, but we had exams. Do you understand? They asked us those questions, but we did not know it. It's only people that were smart that read before or read beyond the curriculum that would have known those things. Do you understand? So a lot of health workers, to be humble about it, a lot of health workers don't have knowledge about breastfeeding. I myself, if not that I'm passionate about it, I do not have knowledge about it. I just decided based on my trauma to do that for my child. There's a course I'm currently undergoing. The things I'm learning about it is mind blowing. I paid for a course, 60,000. There's a gold conference course that I'm currently on. I've not gotten half. It's like 26 speakers. I think I've only listened to like 5 or 6 speakers. And what I've heard about breastfeeding blew, how do I say this now? It's catching my head. Imagine if I knew that when I gave birth to my first child, she would have done 4 years and I don't care. Do you understand? So knowledge is evolving, and a lot of people don't know. They don't know, and it's not their fault. So that's why I've taken it upon myself to do this education. I am learning about it. I am paying for courses. I am going all the way to this thing because I have a passion for it. Because I know that if we can get this right, then we can solve problems about infectious disease. We can solve problems about, poverty. If we can get this right, we can solve a lot of problems. Do you get? So that's it. And I'm happy that you guys took out the time to be here. It means that you are very interested and passionate about it, like I am. You understand? So I'm trying to teach you. The way I taught you now, I taught you like I see you're a medical student. Because this is the way I would have taught. I'm not teaching you like I see I'm teaching a layman. Do you understand? I'm giving you in-depth knowledge so that when you see someone that doesn't know, you can challenge the person and say, no, Dr. Bayo told me that this. That's the power in having knowledge. Do you understand? So any other question?
Yes,
Mary,
ma. Yes,
yeah,
ma. Yes,
okay, I
ma.
can't hear you.
Good evening, ma. Dr. Bayo.
Well done, ma.
Thank you. I joined from Sokoto State.
Ah,
Yes, ma. Actually, I work with in Danfodio Teaching Hospital, Sokoto.
okay,
And I'm in outpatient department, women and children clinic. Most of the time, mothers do complain that baby on their own, some at 3 months, some at 5 months, most of the time at 5 months, stop breastfeeding on their own. In this
okay,
case, ma, what do we do?
okay. So a lot of things can make a baby to stop breastfeeding. Breastfeeding is not just putting the baby's breast, putting breast into the baby's mouth. Breastfeeding is actually uh, a very psychological thing. The baby can sense when you are tense, when you are anxious, when you are not relaxed, when you are stressed. You understand? So it's just like when they say you should be talking to your baby in the womb, and your baby can hear you. You understand? The baby is close to you, can understand. So imagine if, for example, let me give you an example now. I'd say Mary is my friend, and trying to talk to Mary. Every time I try to talk to Mary, Mary will be behaving like as I'm disturbing her. She behaves like what they call it. She is distracted. Will I still want to come to talk to Mary? You understand? Another thing is that maybe the child has been having some issues with poor positioning that have not been corrected. You understand? Maybe it's talking and not getting anything. If it were you are doing something over and over again and you're not getting results, will you continue?
No, ma.
So that's the thing. A lot of things can be in play. So that's why when you want to breastfeed, you need to be comfortable. You need to think happy thoughts. You need to carry your baby in a way that it's psychological. It's what we call responsible. But the mother that is stressed, that has not slept, is grouchy, just stop. The baby will sense it and will answer, okay now, so that we don't do disturb ourselves. Let's just go. I hope I'm able to answer your question.
Yes, ma. Yes, ma. Thank you,
Okay,
ma.
thank you. Any other question? Any other question?
But please, my own question is, how do you manage it career
How
and
do
a
you manage?
resident and
How do you manage
breastfeeding
your?
with career? Breastfeeding with career. I'm a resident and it's not usually easy. So how do you manage it? How do you manage it with career, exams and everything?
Okay, so that is so number one. It depends. You have to make up your mind first. It first has to do with making up your mind. I was a resident when I had my first child, but because I had made up my mind from time immemorial, because I had made up my mind, I said I was going to breastfeed. I was working at the time in University College Hospital in Ibadan. That's one of the most stressful places to work in as a resident, right? But because I had made up my mind, I took my maternity leave and I immediately started pumping. I started pumping breast milk, keeping inside the fridge. You understand? So that when I get to work, I will have enough milk to give my baby. So, but the breast pump I bought was not a very good breast pump. So I pumped a lot, but it was not so much. So I had to bring my baby to work. Thank God for the kind of friend I have, I had a friend that was the chief resident at the time. So she allowed me to use her office. So my girl stayed with my baby in that office. So after work, I would just quickly go to the office, breastfeed a little. Because of work stress, the pumping was not coming out as much as possible. So I'll just do something, leave and go into this thing. It was when my baby was out. It was when my baby was 6 months that I now took her to crèche. So whenever there's a will, there's a way. Once you make up your mind to do it, you will do it. So that's why this education is there, because if you can see the benefits for you and the baby, if you can see what it does long term, you will make up your mind and you will do it. And that's why we talk about support. Imagine if you are in a hospital where everybody knows the benefit of breastfeeding and they are supporting you. They will allow you to go early. If closing time is 4 o'clock, they will give you time to go maybe around 12 or this thing. Do you understand? So that's why the support is very necessary. That's why this campaign is on. Hope I was able to answer your question.
Yes, ma. Thank you. Thank you.
Any other question? Any other question? Okay, so in the absence of any other question, I want to thank you. Thank you for being part of this maiden edition. I want to thank you for sparing your time, even coming before me. Sincerely, let me apologize. I slept off. I did not know that my phone was not. I did not know. Sorry that you have to wait for me. The plan is for it to be less than 30, 40 minutes at most. So that's why I book it down so that it doesn't stress us. Thank you very much. Let me see. So I want us to please thank you. Share the people as many people as you can. The optimal breastfeeding group. If you are not in the group, please join the group. It's not a paid group. There are other groups that are paid, but because of my passion, I said I will not pay. I will not make it a paid group, because I want to make it a paid group. You people will not be able to do this, right? So it's not a paid group. So let everybody come in. Let everybody come in. Share the word. Any girl 20 years and above, uh, grandmother, mother-in-law, even fathers,
20
more
years
people,
and above.
20 years and above.
Okay, 20 years and above. Okay,
Anybody, any woman that is of reproductive age.
okay,
Do you understand?
okay,
If I want to even use that definition, a child that is 14 years old that first seen a menses is of reproductive age. You understand? The earlier we catch them, the better it is for us. Because this is a cheap strategy that will turn things around for you.
okay.
Do you understand? So please share the word, um, share the word, tell everybody that you know, bring them in so that we can all have this communication together. By the grace of God, I pray that the next time we'll be having this meeting, it will be on YouTube. So I will drop my YouTube and my Instagram. Follow me on YouTube. Save my number. Send me let me save send me a chat so that I can save the number so that I can follow me on WhatsApp. I'm not on Facebook yet, but I'll try to block my Facebook for a long time. I'll try to create another account. So follow me so that you can learn from me, because I cannot say everything in the group. So you can learn. Someone is raising up her hand. Muritala, Mutia, is that the raised hand?
Yes, ma'am. Good evening, doctor.
Good evening, ma.
I just want to ask if we can get a replay of this meeting.
Yes, I recorded it. I hope I did. It's recorded. I
Yes,
put
it's
it,
still, the recording is still on.
I recorded it, even though I don't know whether it has stopped recording.
It's still on. The recording is
Still
on.
on. Okay. I recorded it, so I'm going to share it.
Okay, then. Thank you, ma'am.
You're welcome. Thank you all. Do have a wonderful day. See you in the group.
To Dr. Ray. Thank you very much, ma.
You're welcome.
Thank you.
You're
God
welcome.
bless you. Looking forward to being your next lesson, ma.
Okay, ma.